Okay, good morning, everyone. We're going to finish up the Certified Medical Reimbursement Specialist Test Prep series today. We're going to look at the CMS 1500, parts 1, 2, and 3. Compliance has to do with fraud and abuse and HIPAA, as well as the overall general information and what you can expect on case studies. So to get started on this particular one, we're just going to look at the CMS 1500. We do have about 64 questions on this form. You're going to utilize the form and the study guide to answer the question. So it'll be how do you fill in the block appropriately, what's included here, secondary versus primary insurance. So let's get started. All right, the CMS 1500, we have fields 1 through 13, which is our patient information, 14 through 24, which is the physician supply information, and 25 through 33, which is the provider information. You're going to use the CMS 1500 to bill services and durable medical equipment for ambulance, anesthetic, ambulatory surgery centers, nurse practitioners, physician assistants, quick care, such as urgent care clinics, rural health, lab, radiology, mental health, therapy, and optometrist. The form for our clean claim, we still can send paper forms in. So one of the things you need to keep in mind is you need to use one color ink when it's completing it. A lot of times these are going to be typed in. You want to use black. It does copy and send better, but the form should be printed or typed in one color ink. Use no punctuation except where directed. All date formats, even though the form states month, day, year, it actually should be written month, day, year. No whiteout or crossouts allowed, and double check specifics for insurance carriers. Continuing on with what we need, Medicare claims include alpha characters in box 1A. Commercial payers need their insurance ID numbers placed there. List diagnosis box codes in box 21 to the highest specificity. So again, if we have 7 characters, we want to make sure we get all 7 characters in there. Box 24E establishes medical necessity or links the diagnosis, the reason for service to the procedure. So you're going to take box 21 and you're going to link it in that column 24E to the appropriate HCPCS or CPT code. You only need to link one per supply or procedure. A lot of times it gets denied if you link more than one to that particular procedure. Evaluation and management is the only one we link more than one. Box 32, you're going to enter the name, address for the place where the service was rendered. And box 33, billing information, where you want the payment to be sent. A lot of times box the carrier information at the top of the form and the billing information for new billers gets put in the wrong area. So be aware. Who are you sending it to get paid, and where do you want that payment to come back? Injuries. If the patient is injured at the place of work, you want to file an employer liability payer. Employee insurance is secondary. So again, that liability insurance through the company is going to be billed first, and then their group health insurance will be paid second. Rules that apply, box 1A, depending on the accident, use the worker's social security number or claim number per liability payer directions. So depending on the workers' comp, you want to enter that appropriately. Box 4 is the employer's name. Box 7 is the employer's address. Box 10, check the employment yes. And if it is auto, check the box yes. So again, where did it occur? Box 11, use work comp number if not used in box 1A. Box 1C is the employer's department if different from box 4. And box 1.4, list the date of accident. Box 1.6, if the patient is unable to work, list the from and to dates, because that's going to be utilized for them to pay the workers' compensation. So our fields, our carriers and fields 1 through 13. Again, this is the first part of the insurance. The carrier information, as at the top, it does have 4 lines of information. However, most places you're only going to utilize 3 of those. So the third line would actually be left blank. The third line would be like for a suite information, additional information for that department. However, the main address, just like your main address that's not an apartment, the apartment line would be in line 3. That would be an example of additional information. So a lot of times you're going to see suite. So you put the name of the carrier, who's going to pay, you put their first line of address, the main portion of their address. Third line is going to be if you need it, such as the suite. Otherwise, you're going to leave it blank. And then the fourth line is going to be city, state, such as Arkansas, and the zip code. Again, no punctuations, such as commas or periods or symbols. So if the suite number has a number symbol in it, do not use that number symbol. Block 1, this is your payer, your insurer, name, and mailing address. So again, you've got your instructions here. This is listed within your study guide. So what I did was throughout the claims 1500, I added a little bit more information. It may or may not apply to the certification exam. However, you should pay close attention to the instructions throughout the study guide to answer your certification questions appropriately. So with this, you're going to mark one insurance company. It's going to be the primary or who you're billing. If this is the second go around, such as you've received your EOB, then that would be Medicare, or you're going to have your group. Other is for your work comp liability insurance. And then rationale, computers will not recognize a check mark, so you're going to use an X. Okay, block 1A is your insured ID number. For workers' comp, you're going to enter your employee ID. And for other property and casualty claims, you're going to enter the federal tax ID or social security number of the insured persons. Again, you want the number to be as shown on the insured's ID card for the patient's primary insurance plan. So it is unique. Again, pay close attention to the details here. This is where you could get off. Other information that is available for block 1A is our TRICARE. You're going to enter the sponsor social security or VA file number. CHAMP VA is you enter your sponsor social security number or VA file number. Workers' comp employee ID or workers' comp claim ID or the employer's policy number. And then finally, the property casualty is federal tax ID number, just as stated. Block 3, it's your date of birth and sex. This is an instruction you want to enter again the entire month, day, and year. And if the sex is unknown, you are going to leave blank. Again, you need to have that information if all possible, because that could be one of the areas that gets rejected because you failed to enter that. Block 4, Unless required by a specific payer, this field will be completed only if the patient is not the insured. So again, that's specific to that information. If the subscriber insured is other than the patient, such as a spouse or a parent, then enter his or her name using the format. It's going to be last name, first name, middle initial. And then if the patient is the insured, write the word same. For Medicare, you're going to leave it blank. So that's important because they do ask questions. Is it Medicare or other insurance specific questions on your certification? Rationale, Medicare number identifies the patient as the insured, so we don't need to write that in. And then for work comp and casualty claims, you're going to enter the name of the injured person or entity. Moving on, block 5. So you've got your patient's address here. It does tell you the appropriate way. Do not use punctuation again or symbols. And then when entering a 9-digit zip code, do not include the hyphen. So you're just going to add that completely out. It has the nuke. You don't need any extensions. Work comp, property casualty. They require a phone number, so you want to make sure you enter that. TRICARE and CHAMP VA, they're going to read the same. Remember, TRICARE replaced CHAMP VA. So you're going to enter the patient's actual place of residence unless residing overseas. Then you're either going to use an Army, P.O. Box, point of origin. So that's what you're going to want to put there. Block 6 and Block 7. Block 6 is the patient's relationship to the insured. So again, when item number 4, insured name, is completed, only one box can be marked. For Medicare, patients leave blank. Medicare's numbers automatically mean self. So again, we don't have to worry about that. Pay close attention to the ones that you do not need. Block 7, insured's address. Workers' comp claims, you want to enter the address of the employer. For other property casualty claims, enter the address of the insured. If the patient is the insured, you're going to leave it blank. If it is a Medicare patient, you're going to leave blank. So, both cases, the patient is the insured. Block 8, we don't need to fill that out unless you have special instructions to do so. Block 9, other insured's name. So, is only used if the patient has a secondary insurance. So this is a secondary insurance box. For work comp, you're going to leave block 9 blank. Medicare, you're going to fill in last name, first name, middle initial for the enrollee of Medigap policy if different than block 2. If it's not different, you're going to leave it blank. Okay. The participating providers, suppliers for Medicare, complete block 9 if the beneficiary wishes to assign benefits under Medigap policy to the provider known as the mandated Medigap insurer. And you can also be used for supplemental insurances. For Medigap, Medicare supplemental, do not enter supplemental insurance in block 9 at the time Medicare is filed. These are forwarded automatically. Block 9A. The instructions here, enter the policy or group number of the other insured. Again, do not use hyphen or spaces as separator within the policy or group number. The other insured policy or group number identifies the policy or group number for the secondary. And then for Medicare claims, you're going to precede the number with MG. Rationale denotes that Medigap is secondary coverage. 9B, again, you're going to leave it blank unless you have specific instructions to fill that out. 9C. So for this one, it's used to report the employer's name or school name. You're going to leave it blank if 9D is completed. So again, if 9D is completed, we're going to leave it blank. Otherwise, Medigap is abbreviated. For Medigap, you're going to use the abbreviated street address. So 1257 Anywhere Street, Baltimore, Maryland, 21204 is entered as 1257 Anywhere Street, the abbreviated MD 21204. It should say Baltimore on that particular one. Leave blank 9D for commercial insurances or work comp. And for Medigap, you're going to enter the coordination of benefits ID number. The other thing you want to notice here is for Medicare claims, if the Medigap payer ID is not known, enter Medigap plan name. And that's for them to find the information. 10A through 10C is the patient's condition related to. So on this particular one, if it's not related to an employment accident, an auto accident, or property and casualty, you're going to select no on each one of those. If we do have an auto accident, you're going to do the state. We want to make sure that we add that out. Some of your management, your practice management software or your billing will actually have you enter that, and it will automatically be pulled into the claims form. 10D, this is exclusive for Medicaid information. You want to enter the number preceded by Medicaid and leave blank for commercial. So for work comp, we do have a specific note here. Its condition codes are required when submitting a bill that is duplicate or an appeal. So the original reference number must be entered in box 22. Do not use a condition code when submitting a revised or corrected bill. So if this is an appeal or a duplicate, you need to put that information in. However, if it's just revising or correcting, we will not put that information in. Block 11 is the insured policy group or FECA number. So it does tell us, note that this block is for the policy group number. If it is available, the policy number for the primary insurance is listed in block 1A. Do not use hyphens or spaces as separator. And for Medicare claims, enter the word none and skip to 11D. And in a rationale, it tells us that Medicare, that every attempt was made to locate any possible primary carrier before billing Medicare. 11A is the insured date of birth and sex. So again, make sure you enter the complete date of birth. Even though it only has 2 years, you're actually entering 4. X indicates the sex of the insured. Only one box can be marked. TRICARE and CHAMP VA, enter your sponsor's birthday, gender if different from block 3. The sponsor is the person that actually carries the insurance. So it's your beneficiary, it's your insured. And workers' comp, you're going to leave this one blank. For commercial insurances, enter the insured's policy number. Medicare as secondary. 11A through C, also complete 4, 6, and 7. The examples of secondary is group health plan, no fault, other liability, work comp, black lung, veterans benefits. That's an example of when Medicare would be second. Medicare primary, you're going to enter none. And then Medicare terminating event is going to be the insured retired number. 11B, other claim ID. Instructions here. is designated for the nuke. So again, if you have the information, you're going to fill it in. At this time, the only qualifier and accompanying identifier has been designated for use for property and casualty claim numbers. So again, your hurricane, a house fire, such as that, is going to fall under property and casualty. Work comp, you're going to enter the claim number. TRICARE Champ VA is the sponsor's branch and service abbreviation. Block 11C, this is our insurance plan and program name. So no payer ID, enter the complete payer's program or plan name. And for work comp, you're going to leave this one blank. 11D, there's another health plan benefit. So is there another health plan benefit? There's a secondary. So you'll mark it either yes or no. If it is yes, you're going to complete the secondary payer information requested in blocks 9, 9A, and 9D. Okay. And then the rationale, if there is no secondary coverage, blocks 9A through D are skipped. Okay, block 12. Patient or authorized person's signature and date. This is where we have our signature on file. So you'll either enter signature on file incomplete or SOF, depending on the claims, how we fill the instructions, the claims for that. Again, the complete date. And without the patient's signature, you do not legally have the right to release his or her protected information. Block 13, this is the last one for this particular series. So enter your signature on file or legal signature. The insured's authorization person's signature is indicated. Again, without a signature here, the insurance carrier may send the check to the patient instead of to your office. So you want to make sure you have that. A lot of the forms that you're going to have the patient sign, one of them is going to give permission to send the information, the claims, to the insured.